I want to tell you about the HRV testing that we do in the office. HRV stands for heart rate variability. So you've probably seen a chart that looks something like this. This is typically what you see or what is seen on an EKG, that's an electrocardiogram. And it's measuring the heartbeats, and you can see here's the boom and the heartbeat. And the QRS wave is that kind of spike and then it drops down. And so what this measurement actually is how much time is there between one spike and the next spike. So you can see here, this one's 828 and 845 and these other numbers. So there's variation and there's difference in time between this space here and this space here and this space. There's different lengths of time. That is the variability, how much change is there from one to the next. So if you are in a sympathetic nerve tone in your body, that means you are stressed, that fight or flight response is controlling your internal environment, your internal nerve function. We're going to see very low variation in those heartbeats. So they're very locked on, sort of like a metronome. The exact length of time is always the same. If there is more parasympathetic tone, which are the nerves that control the rest and heal and digest functions in your body, we see more variation. So there's a little bit longer here and then shorter and then maybe a little longer, medium, short, long. Between those heartbeats is a greater variation. So heart rate variability measurements we'd like to see as high as possible because that tells us there's a lot of difference between those, and that tells us that inside your body is responding well. It has the capacity to respond well to stresses. And there's not a measurement comparing to, this is the normal range. What we're looking for is what are your measurements compared to your measurements. So when we do reassessments along the way, we want to compare those and see is there a stress response happening in your body or not. The nerves that control the parasympathetic function are the ones up in the upper part of our neck and down through our lower back, our hips, our pelvis, those joints through there. So those are the most important ones to make sure those are functioning at 100% to make sure there's the highest level of parasympathetic nerve function. And again, one of the ways to measure that is that heart rate variability. And so if you have questions about that, just let me know or shoot me an email and I can answer some questions if you have anything on the heart rate variability. Hope you're doing awesome.